Another day, another story. Hello and welcome to our video on Marburg virus. In this video, we'll be discussing everything you need to know about this deadly virus. What is Marburg virus? Marburg virus is a highly infectious virus that belongs to the family Filoviridae, which also includes the Ebola virus. It was first identified in 1967 during outbreaks in Marburg and Frankfurt, Germany, and in Belgrade, Serbia, then Yugoslavia. How is Marburg virus transmitted? The virus is primarily transmitted to humans from fruit bats, which are its natural host. The virus can also be transmitted through direct contact with the bodily fluids of an infected person, or through contact with contaminated objects such as needles. What are the symptoms of Marburg virus? The symptoms of Marburg virus are similar to those of Ebola virus and can include fever, muscle pain, headache, vomiting, and diarrhea. As the disease progresses, it can lead to severe bleeding, organ failure, and even death. Is there a cure for Marburg virus? Currently, there is no specific treatment or vaccine for Marburg virus. However, supportive care such as hydration, pain relief, and treatment of secondary infections can improve a patient's chances of survival. How can Marburg virus be prevented? Preventing Marburg virus infection involves avoiding contact with the virus's natural host, the fruit bat, and practicing good hygiene. Health workers who are at high risk of exposure to the virus are advised to wear protective clothing such as gloves and masks. Let's delve a bit deeper into some of the details about Marburg virus. 1. Incubation period. The incubation period of Marburg virus is typically 2 to 21 days, during which time an infected person may not show any symptoms. This can make it difficult to detect and contain outbreaks of the virus. 2. Outbreaks. Outbreaks of Marburg virus are rare but can be deadly. There have been several outbreaks in Africa since the virus was first identified, with the most recent outbreak occurring in Uganda in 2017. The virus has a high mortality rate, with up to 88% of infected individuals dying from the disease. 3. Treatment. As mentioned earlier, there is no specific treatment or cure for Marburg virus. However, experimental treatments such as monoclonal antibodies and antiviral drugs have shown some promise in treating the virus in animal models. More research is needed to determine their effectiveness in humans. 4. Prevention. In addition to avoiding contact with fruit bats and practicing good hygiene, there are some other measures that can be taken to prevent the spread of Marburg virus. These include isolating infected individuals, tracing their contacts, and safely disposing of contaminated materials. 5. Public health response. When outbreaks of Marburg virus occur, public health officials and healthcare workers play a critical role in containing the spread of the virus. This involves providing supportive care to infected individuals, conducting contact tracing, and implementing infection control measures. 6. Diagnosis. Diagnosing Marburg virus can be challenging because its symptoms are similar to those of other infectious diseases such as malaria, typhoid fever, and Ebola virus. Laboratory tests such as polymerase chain reaction, PCR, and enzyme-linked immunosorbent assay, ELISA, can be used to confirm the presence of the virus. 7. Research. Research on Marburg virus is ongoing, with scientists studying its genetics, pathogenesis, and potential treatments. 8. Global health security. Marburg virus is considered a potential bioterrorism agent because of its high mortality rate and ease of transmission. As a result, it is classified as a select agent by the Centers for Disease Control and Prevention, CDC, and is subject to strict regulations regarding its handling and storage. 9. Impact on communities. Outbreaks of Marburg virus can have a significant impact on affected communities, causing fear and disruption to daily life. In addition to the human toll, outbreaks can also have economic consequences, such as loss of income and reduced access to healthcare services. 10. Importance of preparedness. Given the potential for Marburg virus to cause outbreaks and its high mortality rate, it is important for public health officials and healthcare providers to be prepared to respond to cases of the virus. This includes having adequate supplies of personal protective equipment and medications, as well as protocols for isolation and treatment of infected individuals. 11. Risk factors. Certain activities and occupations can increase the risk of Marburg virus infection, including working in caves or mines where bats live, handling animals that may be infected, and providing healthcare to patients with the virus. 12. Transmission through bodily fluids. Marburg virus can be transmitted through direct contact with the bodily fluids of an infected person, including blood, urine, saliva, and semen. This makes it important for healthcare workers to take precautions when treating infected patients. 13. Spread within communities. Marburg virus can spread within communities through contact with infected individuals or their bodily fluids. In some cases, funeral or burial practices can also contribute to the spread of the virus. 14. Geographic distribution. Marburg virus is primarily found in Africa, with outbreaks occurring in Uganda, Kenya, Angola, and the Democratic Republic of Congo. However, the virus has the potential to spread to other parts of the world if infected individuals travel to new locations. 15. Collaboration among scientists. Scientists from around the world are working together to study Marburg virus and develop effective treatments and vaccines. 16. Symptoms. The symptoms of Marburg virus are similar to those of Ebola virus and can include fever, headache, muscle aches, vomiting, and diarrhea. In severe cases, the virus can cause hemorrhagic fever, which can lead to bleeding from the eyes, gums, and nose. 17. Animal reservoirs. Fruit bats are considered the natural reservoir of Marburg virus, meaning they carry the virus without getting sick. Other animals, such as monkeys and rodents, can also become infected and transmit the virus to humans. 18. Mode of transmission. Marburg virus is transmitted through close contact with an infected person's bodily fluids. It can also be transmitted through contact with contaminated surfaces or objects, such as needles or medical equipment. 19. Treatment of symptoms. There is no specific treatment for Marburg virus, but supportive care can help manage the symptoms and improve the chances of survival. This can include fluid and electrolyte replacement, pain management, and treatment of secondary infections. 20. Vaccine development. Efforts are underway to develop a vaccine to protect against Marburg virus. Several experimental vaccines have been tested in animal models and have shown promise, but more research is needed to determine their safety and effectiveness in humans. 21. Outbreaks. Marburg virus outbreaks are relatively rare but can have a significant impact on affected communities. The largest recorded outbreak occurred in Angola in 2005-2006, with more than 250 cases and a mortality rate of approximately 90%. 22. One Health approach. Given the zoonotic nature of Marburg virus, a One Health approach that integrates human, animal, and environmental health is essential for understanding and preventing the spread of the virus. This includes monitoring bat populations for signs of infection, improving livestock management practices, and promoting wildlife conservation. 23. Biosafety level. Marburg virus is classified as a Biosafety Level 4, BSL-4, agent, meaning it requires the highest level of containment and safety precautions when handling and studying the virus. BSL-4 labs are equipped with specialized equipment and protocols to prevent the accidental release of the virus. 24. Importance of global health security. Marburg virus is a global health security threat, meaning it has the potential to cause widespread illness and death and disrupt global economies and security. It is important for countries to work together to prevent and respond to outbreaks of the virus, including through the development of international guidelines and regulations for handling and studying the virus. 25. Similarities with Ebola virus. Marburg virus is closely related to Ebola virus and is part of the same family of viruses, Filoviridae. 26. Incubation period. The incubation period for Marburg virus is typically between 2 and 21 days, with symptoms usually appearing within 5 to 10 days after infection. 27. Laboratory diagnosis. Diagnosing Marburg virus requires specialized laboratory tests, such as polymerase chain reaction, PCR, and enzyme-linked immunosorbent assay, ELISA. These tests can detect the virus in blood, urine, or other bodily fluids. 28. Post-exposure prophylaxis. Post-exposure prophylaxis, PEP, may be recommended for individuals who have been exposed to Marburg virus, such as healthcare workers who have cared for infected patients. PEP typically involves the use of antiviral medications and may be effective in preventing or reducing the severity of illness. 30. Risk factors for transmission. Individuals at increased risk of contracting Marburg virus include healthcare workers who come into close contact with infected patients, individuals who handle bats or other infected animals, and those who have close contact with someone who has the virus. 31. Case fatality rate. The case fatality rate for Marburg virus is estimated to be between 24% and 88%, depending on the outbreak and location. 32. Global surveillance. Surveillance for Marburg virus is critical for early detection of outbreaks and effective control measures. The World Health Organization has established a global surveillance network for Marburg virus and other viral hemorrhagic fevers. 33. Need for continued research. Despite significant progress in understanding Marburg virus, much remains unknown about the virus and its transmission dynamics. Continued research is needed to develop effective treatments and prevention strategies, and to better understand the impact of the virus on human and animal health. In summary, Marburg virus is a highly infectious and deadly virus that requires careful attention from healthcare systems, public health officials, and communities. Conclusion. Marburg virus is a deadly virus that poses a significant public health threat. It is important to be aware of the symptoms of the virus and to take steps to prevent infection. If you suspect that you or someone you know may have been exposed to Marburg virus, seek medical attention immediately. Thanks for watching.